If you want to solve a problem, go to the source closest to the problem. In this case, doctors and patients, not bureaucrats. We do not have a health care problem in America. We have a health care cost problem in America. And that's different. First, the health care cost problem in America. It goes all the way back to 1943, when businesses, in an attempt to attract the best people because of freezes on wages, started offering benefits. Well, they never got out of that habit. And so, unfortunately, many people have grown up accustomed to somebody else paying their health insurance, including the government, and so they spend it, they select benefits based upon it being somebody else's money. That's a very fundamental point in life. People spend their money better than other people's money. And so as long as people believe that they're spending other people's money, costs are going to continue to escalate. I believe in the free market system. And I happen to believe that when we let the free market system do what it does best, when we allow competition to do what it does best, it always brings down costs and increases access. The way that I am going to help all of us convince the American public that we've got to restructure Medicare and not just change the benefits and the retirement age is to paint a real clear picture of the disaster path that we are on. That's number one. So we have to restructure how Medicare is administered, how the dollars are spent, and then relative to its cousin, Medicaid, I believe we should have a block grant approach. Put the decisions closest to the users. I totally support tort reform and loser pay laws. Loser pay is step one. Total tort reform, which some of the attorneys are going to fight you on. Maybe it's not totally changing the system, but the system needs to be refined, because many doctors have told me that they are forced to practice defensive medicine. I happen to believe that that is going to bring down a lot of the frivolous lawsuits, which is going to reduce the cost that doctors have to pass on to their patients. Change the laws where insurance products can be sold across state lines. I know some of the insurance commissioners are going to fight that, but that's how you get more competition.
And you think you can do that as president? You think that's something that's
Yes, sir. I believe that I believe that I can lead that effort. Whether or not each state has to do it or we have to do it region by region, not sure the specifics, but if I lead the effort and explain to the American people, just like you pointed out about car insurance, how your rates go down because of competition, I believe that we will be able to make some changes in that regard. Pre-existing conditions. I do believe that government has a role to provide a safety net and to provide a means for people with pre-existing conditions. Pooling, whether that pooling needs to be at the state level or whether it needs to be a national pool for people with pre-existing conditions that can't get insurance otherwise. I don't want to leave anybody out of being able to get health insurance coverage. And so we just need to determine what's the appropriate level of what that type of coverage ought to be.